Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Every time Robert Amoré comes on, I want to sing Amoré. We always laugh about that. But the interesting part about all this is that when he and his associate, who is Pepe, came in, who is the patient educator, Robert Amoré was thrilled that he had just done some stem cell work on some patients. Now, stem cells, Robert, I guess about, 5 years ago, was not casual. You either had to go abroad to get it, or it was something, it was spooky, who knew what it was. But you somehow knew that it was the right thing, and you have really perfected it, haven't you?
Yes, I think, we saw what was coming on over the years, and, people are looking again for something that is a little bit less invasive than they've had in the past. And with stem cells coming out in the last couple of years, more so, I said this might be the way to go for our patients. So we went ahead and opened up our new clinic, and more regenerative medicine and anti-aging. So,
well, the nice thing is that people are not afraid of it, because for so long, people were not, they thought, well, that's something big, and they're going to cut into my bones, they're going to do all this. Well, they're not. Why don't you give a very fast idea of what it is?
Well, stem cells are cells that are basically we pull them from the cord of a full-term delivery of the baby, the placenta and the cord, and we gather those stem cells from that cord, and we go ahead and clean this all up and check everything out before we even do anything. Make sure everything is clean. Make sure that for the 9 months that we're doing this, and they have to watch the mom to be for 9 months too, because they're not going to take anybody's cord or placenta. They need to make sure that this person has no diseases, no problems, no this, everything. So they watch this whole thing before they gather these stem cells, and then they go ahead and they say to them, they'll tell them, well, okay, we'll take your stem cells if you allow us to utilize, your cord blood. We want to use some of your stem cells, and we'll freeze it for you, and we'll save you money this way instead of, years ago they used to charge a lot for a year to freeze these cord blood and the placenta for stem cell use for later on. So now the charge is diminished. It's very little. It's like $199 for the whole year. So that's an expense.
Oh, that is really amazing, because some people were spending $5,000, weren't they?
Right. So they now can go ahead and control that, and that's how they gather the stem cells. Okay. Again, we want something that's newborn stem cells from the cord blood, not from your own body. We want something from fresh newborn, because you have a lot more stem cells in cord blood than you would in your own body. So a stem cell, let's get to the basics. Stem cells are like a neutral cell. So when you inject a stem cell into your body and you have inflammation somewhere, you have something that is hurting you or not working properly, it goes to that area and starts to grow tissue that makes that whatever, maybe kidney or liver, whatever, it starts to improve on that. And so now you're basically building up that whole system again and make it function better. And now it takes on your own DNA. It doesn't have DNA. Stem cells do not have DNA or anything. They're just clear slate. So they can do bone tissue, they can do heart tissue, they can do muscle tissue, they can do different types of tissue in your body, kidney, whatever. I mean, this has been going on for a long time, just not so much in this country, but
that's
this
right.
is the thing. So that's how we do the stem cells, and we go ahead and once we have a client, and we tell them, we break it down and say, okay, what are you here for? First of all, if it's a knee or a shoulder or a hip or something else, again, and then it's a process that takes probably less than 45 minutes in the office to do, and they walk out.
So what you're saying, Dr. Robert, what you're really saying is people who were going to go and have knee replacements, hip replacements, and all this. You are now going to be able to do stem cells where they won't have to have that.
That's what we're going toward, yes. And this is what's really exciting about this is that now you can do this instead of going down that path of surgery where they did in the past so many years, where they replaced the joints, the hip joint, the knee joint, they replace it. So when they replace joints, there's a little bit of craftsman tools going on there. They have to get it to fit just right. There's a big surgical opening. It's not like a little hole.
Right.
And there's possible infection from that. There's definitely a time that you're going to be laid up for. Could be 6 months or more. And so there's a process of getting back to where you were. And then when you get back there, you still might not be 100% again. They'll never tell you to be 100% or, you might get around, if you're lucky, 60%, 70% if you're lucky. And it's a long-term process, and so stem cells bring in that whole idea that now we can go in there, inject tissue. Stem cells are actually the exosomes from the stem cells that produce the new tissue into the body and grow your own new tissue with your own DNA, without causing
amazing.
infection, without causing problems, and being able to walk out the same day and go back to normal daily activities the same day.
Okay, so do you do this in your office, or you have to take them to the hospital? How is this all done?
We do this in our office. It's in office. We have a facility to do in our office. We prepare everything in our office. So there's no reason to go to the hospital. We do some preoperative stuff, or if you want to call it operative operation, but we do blood work. We want to make sure that everything is right in the blood work. We want to make sure that they are getting off anti-inflammatories. You don't want anybody taking anti-inflammatories when they're doing stem cells.
Oh, why is that?
Well, because stem cells gravitate toward inflammation, and anti-inflammatories decrease inflammation. We don't want to decrease inflammation, so we want to keep the inflammation going so the stem cells will attach. So that is a very important part of all this. That's pretty much how that would work, and so I would say that the more that we see in our office, and these patients come in, we sit down with them and give them that information of what they need to do and what they, and how they need to proceed forward after that. So that's really, how we're doing that.
Okay, so now we've talked about that, but you do a lot more, and I'm going to just go over some of this stuff. I see on your list of exciting procedures, hair restoration. Now, I mean, you have a gorgeous head of hair, so you don't need this. But how do you restore hair?
Well, hair restoration has been around for a long time, but not with so much.
Has it been real, though? I mean,
well, they've done plugs, they've done pieces. You've seen all this before, weaves, all these different things. But now you could do hair restoration into the follicles with what they call PRP and stem cells. PRP is platelet-rich plasma, which you inject in there. You microneedle all this into the head and the scalp, and you basically are setting it up to grow. It's like planting the seed and then fertilizing it. I mean, that's really what it is, and it grows, and you have new hair. It's amazing, without going through that whole process they did in the past.
And do these types of things take long? I mean, so if you go for hair restoration, are you looking at 6 months?
Well, the procedure itself, it might take an hour or more in the office, depending on how much hair loss you have and how much we have to do. The time for it to restore itself, yes, it has to take. So there's a process, again. So, again, a month out, 2 months out, 3 months out. So I always say the 3 month mark is a nice mark, but hair will grow. You figure 3 months to 6 months, but you'll start seeing changes within that time.
Okay, so Rick Pepe, here we are, and you're sitting there with a big smile on your face, and you love what's happening. Tell me what your favorite procedure is when people come in, and what they're most happy with, and what you love to see happen.
The stem cells. I mean, that's something. They come in, they have a lot of pain. a lot of discomfort. The quality of life is not the same. So when they have this procedure done, you see them a couple months after the procedure, and you can see how well they're doing. You know, that makes you feel good inside. You're helping this person with their quality of life, and they're happier, they're less depressed, you know, and they're enjoying their lives.
And do they have to come back once it's done? Do they have to keep coming back?
They come back for after the initial stem cell procedure. They come back a week later to reevaluate the patient. We do call them for the first, bi-monthly, but I still call them once a week to make sure that they're doing okay. If there's any issue, they have to come back to the clinic where we can resolve it.
Okay, so you get to really know those patients, don't you? They become friends.
Yes.
I can see this.
Yes.
Okay, well, I want to ask you a couple of other things. I see that, we have facial rejuvenation, but even erectile dysfunction now. You know, we see so much of that all around now. And tell me, maybe we should have Robert explain this. Tell me what you do with the ED. I mean, are they shots or what do you?
Yes, they are shots. They're actually, with the male, they call it a P shot, and the female is called the O shot.
Oh, you have for females also.
Yes,
We didn't even talk about
both
that.
Sides of the coin there.
They don't mention those things on television.
Yeah, they don't. So, with men, as they get older, the
Well, the
erection,
blood, of course,
their
blood flow,
is
sure.
decreased. So that's a big thing. So they're looking for something where they don't have to take the pill. Again, getting away from pills.
Right.
So you want something that they can, quickly, get erected.
Yes.
And that's what they're looking for. So we do. It's called a P shot, and there's basically 6 shots that you inject into the shaft of the penis, and
6, but 6 times.
No, well,
one time,
3
three
on
times.
one side, 3 on another side.
Correct.
I see.
And you do that one time, but you might have to do it again. If we're using PRP, we might do that, another 4 weeks out, and then another 4 weeks out from that. So I might do it in 12 weeks, 3 times. But that actually works really quick, because that starts to rejuvenate that area and starts to grow, get that tissue and open up the vascular area. It's amazing how this stuff works.
Yeah, I mean, you're really. I am so pleased that you've come on our radio show to talk about all these things, because you do a multiple amount of things. And so, Rick, when I first asked you this question, I mean, you chose the stem cells, but seems like a lot of the other things have the stem cells. Almost everything I see on a list.
Absolutely.
So, all right, so when people come in, are they afraid? I mean, what is it? Well, actually, what does a stem cell look like? I guess I wanted to ask that.
It doesn't look much like anything. I mean,
it's a cell.
It's a cell. It's a tissue. You don't really notice it, because it's frozen in a little tube, and it's in a minus 273 degree, liquid nitrogen. It's frozen. They're not gonna see it. We put it in. We have to thaw it out, and then we have to draw it out of there and put it into a syringe, and mix it up and get it into the place where it's going. So you don't really see it. You don't know it. It becomes a fluid once.
And go ahead, Rick.
I mean, some people, they may fear that it's very painful, and actually, it's not painful at all. Some people, because it's a needle. Mm-hmm. So once you get that out of your head, that it's, it's, you try to explain to them, say, listen, it's not as painful as if you were to get surgery. Mm-hmm. This is the less painful way to go, and the fastest recovery than surgery. No downtime like surgery.
Well, and also surgery now in the hospital, you wind up with a lot of other problems. You know that.
Well, infection, that's a big one.
Absolutely.
Infection, that's the other big issue. And what happens is a lot of times when you get an infection, it causes you not to heal the proper way. Oh, and that's why a lot of people down the road, they have, joint replacements done. A lot of times they don't want to have another joint replacement done.
Yes. Because
they're having trouble with that one they already had done.
No, you're absolutely right. So I was going to ask you, though, about diabetes, because I see that we talk about diabetic foot ulcers. There are people who are really, sometimes they have amputation because of this.
Gangrene.
So what do you do for this, Dr. Amore?
Again, diabetic ulcers or ulcers in
Are you
general.
Are you actually using stem cell in
Stem
that?
cells, yeah.
And
again,
why is that necessary? Why can't you heal a foot ulcer?
Well, because a lot of it has to do with, if it's diabetic,
Yeah.
you're bringing in a whole nother aspect, because now you're talking about the pancreas and it's not working properly. So because of that, it creates a non-healing ability. So you have to get something in there that will generate healing quickly. So this is one of the big problems they have with ulcers and bed sores or whatever. All these things, they take a long time to heal, especially if they're diabetics.
Intermittent claudication,
Right.
poor circulation to the lower extremities. So what happens is you're not getting the required nutrients down there. It causes that tissue to die off over time. So a lot of times that's to do with circulation in that area.
Yeah. So.
And that's a big thing with neuropathy too. You hit it on the head. Neuropathy again is a circulation problem, nerve problem. The nerve, the myelin sheath kind of unravels, and you have a neuropathy. Well, lots of people have neuropathy. You hear it all the time, but they always think, well, I don't have diabetes. Why do I have neuropathy? Well, you don't have to have diabetes to have neuropathy. So these are other things that we can start working on with people, that have difficulty walking, whatever. We can start injecting into, the feet and different areas. Yeah.
So, have you dealt with people with cancer? Is there stem cell? I mean, maybe that's a little bit out of the sort right now, but it's coming, probably, isn't it?
And there's definitely.
We don't want to get you in trouble right now.
In this country, they don't do that, but other countries, yes, they have done it, but not this country.
But it does make sense, doesn't it?
Makes a lot of sense, and I'm sure there's a lot.
Eventually, that will happen because, I mean, if you could, repair certain parts of your brain or your body with good stem cells, I would think that's the way to go.
Well, I did have a family member that had stem cells done for cancer.
Really?
Yeah.
outside the country?
No, here, up in
Here.
New York. Yep.
Okay, and what was the outcome?
She did very well. She had originally she had a 4th stage breast cancer. So after her 5th year of her checkup, they realized that the cancer spread to her spine. So what happened was there was the insurance companies at that time, obviously they don't recognize it, they don't pay for stem cell treatment. It was very controversial back then. So she knew somebody that was a senator in New York, and he actually helped her get it done, to push it through, and she had it done upstate New York, and she did very well. She lasted another 17 years.
Oh heavens, this is that's a wonderful story.
If she didn't have it done, she would have been gone less than a year.
Then you did bring something up. Is this insurance? People will pay what you're doing? Because you said something about insurance.
They don't.
They don't pay this.
Not with the stem cell yet. There are some insurances. We're working on some things right now, regarding PRP and some other things you utilize with, the procedure. But stem cells, they're not paying for it yet. I have to say there's another thing, the hyperbaric oxygen, which is fantastic. They won't pay for that only if it's a wound, which is so dumb because it's been proven. Well, we won't go into that, but we do know things. But it seems like what you're doing procedures that are cutting edge. It's obvious that you're getting into all sorts of very exciting medical work that people will live longer, they'll live better, they won't wind up in the hospital. And we just want to promote you that you do this, because I don't know of another organization like you, at least here in South Florida. Well, you hit it on the head, Anita. Living longer is one thing, but living better is what, I mean, anybody can live long today with the drugs they have, but living better, being able to function, being able to do the things you were doing before, lift your kids up, your grandkids, just walk to the park with them. These are people that, they're not, there's no reason to put them in the corner. I mean, they should be living, and I think that the society needs to start looking at that. Just because we're growing older doesn't mean we need to stop living.
Right, but living though without surgery.
Without surgery.
See,
and
so
living
that's
better.
the whole point.
Quality of life is
Right.
key. Yeah.
And do you have enough people now who, once they have it done, they're living well from all this?
Doing well.
Doing very well.
Very
They are
well.
doing really
So that
well.
must make you so happy.
Yeah, it's very, very
Gratifying.
gratifying. Yes.
So they really go out there and they're your best
and
ambassador.
they're starting to recommend other people to
course.
come in, and that's the biggest thing with us. We like word of mouth.
Yeah.
That's the biggest thing and it makes you feel good.
Of course.
Inside, because you're helping people.
Right. Do you have more men in your practice now? I mean, more patients that are male or female?
It's kind of an even keel. I mean, there's definitely a few men that have some knee problems, but women too. I mean, we have a postal worker that has a knee problem.
Well, postal worker, right? I love them. I love them. They work so hard.
Mm-hmm.
Well, there is a word here that I don't really know what it is, and I have had this. This is people have told me about prolotherapy.
Yeah.
What is prolotherapy?
Prolotherapy is an old therapy, very old therapy.
Yep.
They use it's like sugar water. They used it years ago. It's like putting sugar in, and it helps. It actually helps. Believe it or not, this is so. I mean, it helps the heel and tissue and actually it's just an old type of therapy. It's real simple therapy, and they've done it for years. But it's really a basic therapy. It's really when I say sugar water, it's like putting saline, and it's saline really. And
when would you use that?
You can use that. I mean, some people use it just to treat some basic like even with the wounds. You can inject the saline. It's just the old-fashioned type. You know how they used to the Dead Sea. They used to sit. It's the salt water. It's old, but it works. So they've had it for years. But it can treat like muscle aches and pains and different things like that, and they would inject that in therapy. But it's just a very old therapy. I just threw it on there because I said, hey.
No, but I've been curious because there have been people who talk. They say, "Well, I do
prolotherapy."
prolotherapy," I said, and I never really got an answer.
Yeah, it's a very basic. They use saline solution. It's just very basic.
Which helps to heal.
Yeah, and it's just, but it's so old. It's like, but it's
well, sometimes old is good.
Good, yeah. It's very basic,
right?
but it works.
Absolutely.
But it works, and that's why I put it on there because it's one of the ones, the first ones they ever did way back when. Yeah.
Okay, well, we're going to take that.
Mm-hmm.
So I'm going to keep going on this list.
Yeah.
So now, I know that we've talked about platelet-rich. Now, what is platelet-rich fibrin matrix?
Yeah, it's so that is okay. So you take the PRP, right? You take that, you spin it down, you get the PRP, the platelet-rich platelets. I mean the plasma.
Now, do you get that from somebody's
you pull
bone
it from
marrow?
No. You pull it from their blood. Like phlebotomist.
Okay.
You just pull it from your blood. Like you're taking blood.
Right.
You spin it down. Now the PRFM is when you go ahead and heat it up, and now you use that as a filler. So instead of using like Juvederm or Restylane, all those other ones,
this is for rejuvenation.
You use for facial. So then you put that as a filler. Now that will keep on reacting with your body and growing new collagen and elastin, and it's a filler, so it stays in it. Whereas the Restylines and other ones will eventually die out in 3 months or whatever.
Well, that's fabulous stuff, then, isn't it?
Yeah. So that's a
platelet-rich fibrin matrix, platelet-rich plasma treatments using your body's own natural blood cells.
Yeah.
Wow, you must be having a lot of fun, both of you, in discovering all this. So you, of course, call your company, and I want to just go over this because it's anti-aging, and everybody says, okay, well, I want to do anti-aging, but let me just give a phone number. Let me give some ways that people can get a hold of you here. Okay, they're located in Coral Springs, and their phone number is 954-755-0224. That's 954-755-0224. The website is Amore AntiAging, AMORE, antiaging.com. Amore AntiAging.com. And and they're located at 1500 North University Drive in Coral Springs, and they've been voted the best regenerative medicine clinic. And I really hope that you'll go to meet them. Of course, you can get on YouTube. You'll be able to see them also. You can get on Facebook Live where we are now. We've had a lot of people watching this. But they do stem cell therapy, hormone replacement therapy, platelet-rich plasma, facial and hair restoration, joint rejuvenation, physical therapy, massage therapy. Oh my goodness, it's certainly Amore, right? Okay, and the phone number again, get your pencils out. Remember, it's Pencil Talk Radio. It's 954-755-0224. Well, you are just great to come in, and I know that I'm taking you away from your patients, but it's worth it.
That's worth it. That's worth it.
And thanks so much. I always learn a lot when you come in, and we look forward to hearing you again.
Oh, thank you for having us.
Thank you for having us, Anita. Appreciate it.